Well, Angela, to start off, tell us about your journey. As you all know, she's a nurse, she's a clinician, but you've made a transition to being the president of a healthcare AI company. And uh, we've got a lot of entrepreneurs here. uh, and I think we can get stimulated by each other's stories. Tell us yours.
Yeah, absolutely. And good to see everybody. Lots of friendly faces on here. I see a lot of people I need to catch up with anyway. So, happy New Year to everybody and so excited to be here. A little bit about my background. I think for those from the block party, some of this might be repetitive, but my background is in nursing. I started in ICU nursing at Duke University Medical Center and did both cardiothoracic ICU, which was mostly heart and lung transplants, and then moved to CCU and loved that as well. That was mainly taking care of pre-transplants and heart failure patients. Um, got a little burnt out in the hospital. I'm sure you guys have heard of that before, this burnout situation, which is not new to healthcare. It's been happening for, decades now, but wanted to still make an impact to both patient lives and clinical care, but really did not want to be at the bedside anymore. So started looking for avenues to kind of leave the hospital. And one that came about was medical legal consulting. And it was a quick, like 6 month certification. You could work for both plaintiff and defense, and you could review medical records for, was there an issue? Was there an error that occurred? I loved that. It was so informative, and I worked for defense at first and then moved to the plaintiff side. But what it taught me is really, you look at a lot of worst case scenarios in these charts, but in a lot of them they had a common thread, and it was between understanding that a medical device kind of malfunctioned or a clinician didn't know how to use a medical device properly. So from there, I went and launched a career in medical device for a company that was called Bard Medical, CR Bard, and that was my first like corporate experience. I loved it. I was there for 6 years. I kind of grew into multiple different roles there. My clinical mind was very impactful to the business side for them. And that was my time. They put me on a mergers and acquisitions team to go out into the United States kind of startup environment and find different types of devices that would work for acquisition. During that time, that was when you guys are going to recognize these terms. Everyone was using the word big data and predictive analytics, and that was like the cool thing to talk about. And, EHRs were going to change the world. And we were, in 3 years, we were just going to have nothing to do as clinicians because EHRs were going to solve all of our problems. And so I left and ended up going to my first AI company. I think I was like employee number 14. It was a big leap for me, as you can imagine, going from big hospital to big corporate America and an $11 billion company, and then going to a startup. It was like, wow, what am I doing? Is this the right move? Is this smart as a career decision? But I had to try it. I loved what the ability to predict using data could do for healthcare. At that moment, it was an ICD-9, ICD-10 prediction code that basically could predict for hospitals based on claims data what their revenue potential was going to be for the next year. So we had just tons of claims data being pushed at us. And that company ended up, or that portion of the company was sold within the first 8 months. And then I got the bug. It was like, wow, this is fast and furious and exciting. And, we're doing all of these cool things. Well, because we had all of these mounds of claims data, um, our data science team was like, hey, when we combine all of this historical claims data at the individual patient level with consumer purchasable individual patient data for like social determinants of health and understanding how the patient lives and what they consume outside of the hospital, we can start to predict at a really high level outcomes that are negative. So a readmission within the next 30 days, a 90-day avoidable admission, a heart attack, a stroke, all kinds of negative outcomes that you would want to impact. And we could predict them at a really high level. And so that was born Javion. That was our last company. We ended up selling that company in 2021. Part of that company was sold to Cerner, which, as you guys know, is one of the largest electronic health records. And then part of that company was sold to a care orchestration company called Lightbeam. So this is my third really AI company in Inflow Health, and really excited for this journey. Jim,
Yeah.
does that give you enough background?
Yeah. What a interesting life you've had, Angela. And just so people know, where are you located? Where are you broadcasting from? South
Yeah,
Carolina?
I'm in Charleston, South Carolina. So pray that we don't lose our power because we've got like 60-mile-per-hour winds going on right now.
Yeah, well, I'm in Baja, California, in Mexico, and the power went off a little while ago. So I'm hoping we don't lose the internet. If we do, Tiago will take over. So, Angela, you've really been on a lot of interesting leading edge uh, initiatives. How did you manage that? Were you prescient? Did you know what the future was going to look like? Did you know where healthcare was going? Were you lucky, or how did you get yourself positioned in such a good place?
Great question. I feel like a lot of people ask me that. I don't really believe in luck or coincidence. And I definitely took a lot of risks to be where I am today, and I took advantage of every opportunity to its max potential. I spoke at my alma mater recently to a women in business group, and one of the questions that came from the audience that was from a younger generation, she said, "Hey, I'm in a position right now where they want me to do my role, but they also want me to do this other role. And I feel like I'm working for free." And I kind of like chuckled to myself because in answering your question, every role that I was in, I always was doing that role plus whatever the role was above me to prove that I could do it and to show that, hey, you're not going to take a risk by putting me to the next level. And so I feel like that's probably more than anything what led to my dynamic kind of roadmap and entry point to where I am today. I never, if you would have asked me 5 years ago, I never would have told you that a CEO of my own AI company was what I wanted. In fact, I kind of prided myself in being all of these different levels within the organization, but I never really thought of myself as a CEO. But I was in a meeting, and this is just Jim and I had talked about this previously, so I think I'll bring it up now. It's what did you call it? A negative influencer. In my
Yeah,
previous,
well, in Angela's disruptors club, uh, we were talking about things that have happened in our life that had quite an impact, and it was interesting because so many of us talked about bad things that happened, or things that we got just mad about, and how that was as much of a motivator as anything's. And I was just so taken by Angela's story of one of those.
yeah, so at our last company before we sold the company, the private equity company that took us over, they decided to bring in a new CEO. And it was probably about 3 months into that relationship. I had never met him in person, but we ended up at a client site together, and I was presenting to the executive group at this health system. So I did my presentation, and we walked out of the room and we were headed towards lunch, and he said, "Man, that was a really great presentation." And I was like, "Well, thank you." And he said, "If you were a man, you could be a great CEO." And that like comment just really struck me. Um, and at first I was kind of taken back by it. I didn't react to it. And then the more I thought about it, kind of the more angry I became about it. And we ended up having like a one-on-one 3 weeks later. And I asked him, why he made that comment. And he said, well, you just don't see a lot of women in leadership roles and you don't see a lot of women leading companies. But man, glad to have you and glad we have such talent on the team. And I think that was the moment where I was like, I think I need to be a female leader and I think I need to do this and I think this needs to be on my roadmap and my goal. So it was definitely a negative motivator, but I wouldn't recommend that CEO to anybody here, but he definitely motivated me to think outside of my own career path.
So tell us about Inflow Health. How did you get that idea?
Yeah, great question. So in my previous company, we had a colleague, Jill. She was another nurse. She worked on our team, really wonderful person. She went to the hospital, to the ER, had severe abdominal pain. They were trying to figure out what was going on, right? They did a CT of the chest, a CT of the abdomen, just trying to figure out what was the cause of the pain. They ended up finding out that she had acute appendicitis and it had ruptured. She needed to be taken to the operating room. And this was a great health system in the Northeast. I won't mention the name, but like if I did, it's like one of our top in the country. So she goes for surgery. They obviously have to pay attention to that first and foremost. She ends up having to stay in the hospital, get some IV antibiotics, etc. Well, 9 months later, she goes for her regular screening mammogram, as like most of us women have to go to after a certain age. And the radiologist says, man, why didn't you ever follow up on this breast lesion? And she was like, I don't know what you're talking about. Nobody had talked to her about the fact that in the ER, when they ran that imaging to find out that she had acute appendicitis, she also had a pretty significant breast mass that was cancerous. And so they didn't notify her of that. Nobody gave her that detail. Nobody told her primary care physician. And so there was no follow up ever placed on that. So unfortunately, Jill kind of went through the next year and a half of treatments where she had metastatic breast cancer at that point. It had metastasized to her brain and it was inoperable at that point. So we ended up losing Jill in 2021 after a pretty significant battle. And it taught us all really back then, hey, let's start looking at the data around this, around radiology follow-up specifically, and see how often does this occur. Since we had 45 plus different health systems using our solution, then we had our hands full of data. And what it showed us is that depending on the health system, between 60 and 75% of radiology recommended follow-ups were missed. They never occurred. And it was such a substantial problem. And it was so shocking that when we started breaking down, like, what is it about the process of this that is falling through the cracks? It really came down to there's a radiologist over here. Sometimes they work for the hospital, sometimes they don't. There's a patient in the middle. There's a provider over here that ordered the original study. And there is a severe lack of communication between these three elements. And this is not new to healthcare. I mean, care orchestration and communication is definitely a deficit that has gotten worse in healthcare and that we know exists. But in this specific thing, it was dealing with, a cancer that was being caught by a radiologist, but then never got the next step in care. And so when we started looking at the data, man, our minds started spinning around. This is a really great application of AI. As you guys know, 70% of the electronic health record is in what we call unstructured data, not in a discrete field. It's in a dictated note, progress note by the physician, or it's in a really lengthy history and physical, or it's in a dictated radiology report or pathology report. Because all of those elements are considered unstructured, they're not discrete fields in each different row. It's really difficult for you to make that data meaningful. So the impact of using one type of AI called natural language processing, some people call it natural language understanding. You'll hear it computational linguistics. There's all kinds of words and forms that people use, but it is probably first and foremost a way to unlock your electronic health record today. And in fact, as strategies go, I tell people, hey, use as much NLP to unlock what's in your electronic health record as possible, because it's a really well matured area of AI. So it's not like generative where we're still kind of learning things about it. It's really in this sector of AI that's very much stabilized, it's mature, it's used across multiple industries. So what we did at Inflow Health is we first and foremost built what's called a large language model. So large language models are basically teaching computers to understand how we as humans speak. That is the bottom line of what a large language model does. We built one to just read, interpret, and understand radiology language. So millions and millions and millions of reports come at us. We teach the large language model how to read, understand, and interpret radiology language. And then what we're able to do is set a goal. So our goal was, can we read in real time every radiology report and pull out any that have basically identified follow-up, no matter where it falls in the report? The harder part of Inflow Health is taking that then identified follow-up and making sure that all of the downstream care orchestration occurs, the communication pathway back to the physician to prompt that next step, whether it's an acceptance and an order or a decline, or whether it's communicating with the patient, like, hey, you were just in the ER, you had an incidental finding, and here's the action that we want you to take. So really what we did was we combined identification and using AI for identification in real time with automation strategies and how to make sure that the workflow works seamlessly without having to put a lot of burden on the staff. So we started that company in 2021. So this is, 2024. We're a couple years into this, and it's going really well.
So could you tell us about some of your target clients, some of the work that you're doing now, and what kind of problems are you having, Angela? In a lot of our club collaborations, we're scratching our head and trying to figure out how can we get to the decision makers right now. They're busy, they're distracted, uh, they're depressed, a lot of cases, and they just are maybe not willing to give you much time to talk about yet one more thing for them to put on to their plate. So could you tell us about the challenges that you and we have to get to decision makers in healthcare organizations now? And how are you doing that? Are there baby steps to show them what you can do without having to sell them a big contract before they know you very well?
Yeah, great question. I've spent a lot of time swirling around this one, especially for the past year, year and a half. I would say pre-COVID, it was easier to get people's attention. They weren't so focused on what I'm going to call day-to-day tornadoes and fires and staffing issues and staff burnout and turnover and, managing a new, practice that they're bringing in, or I had a hospital system CEO last week that was like, yeah, my anesthesia group like quit last week. So I had no anesthesiologist. Can you just like even imagine that for a second? So you can imagine that like getting on the phone with like a new technology or talking about process or quality improvement or talking about any of those things when you're like in the middle of survival mode is the environment that we live in today. But I find that like when I'm talking to my health system CEO leaders and friends, because I've just been in this industry for so long, they're like, man, how do I get out of this vortex of just like handling the day to day and like rise above that so we can be transformative and we can start to unlock some of these things that are so necessary, but it's like they're in this constant swirl of the day to day and it's really tough to like reach above that. And I'm not sure that I have the answer to that, Jim, but I have tried lots of different strategies over the past year, year and a half to get attention to something that I feel very passionately about, and I feel like every hospital system needs, since we primarily sell to hospital health system and radiology imaging practices. I'm faced with this every day. And I know actually tons of faces on the phone with me today. We're all faced with this struggle. Like, we have an amazing thing that we're trying to do for the health system, but it's like we can't get their attention long enough to help them get to the next level, which is what they really want and what they really need. And some people are out there doing it. Some people are out there doing it well. And I've watched some presentations recently of leaders that are like, hey, we have to take a step back and we can't just continue to swirl. One thing that we found that really has made an impact, and in the beginning, I thought, it didn't make sense to me, but I'll explain. So originally, when we went about this, I would show people national data and benchmark data for this 60 to 70% of missed follow-ups. Well, for those of you that are thinking from the business standpoint, if you're missing 60 to 75% of your radiology follow-ups, that's a whole lot of money to the healthcare organization in radiology exams. And that is usually a really big dollar service line for the health system that drives a lot of revenue. And if you think about that, and then combine that with like the patient safety and mitigating the liability and the risk on behalf of the organization, you start to have all of these value statements that come together. But if I'm talking to a system level CEO or COO or CFO, I can usually get their attention with the revenue piece, right? So when I changed my messaging away from patient safety and quality, which is really what we do at the end of the day, and told them we could actually help them make revenue while forwarding all of their goals along patient safety and mitigating their liability, it started changing how many heads I turned. So that's been one strategy. The other strategy is we now come in and pre-contracting, we'll sign a small agreement where we take some data from the hospital system and we show them where they are. We show them how big their gaps are. We show them where their potential is. And we help them understand what is a strategic way to approach this implementation to really solve all three of those: the patient safety, the mitigating the liability, and driving revenue and, preventing leakage inside of the system. That, I think, has turned more heads for me than you can imagine. Also, memberships like Medvale, like Mernal, he's sitting here on the phone with me. He helped me get in front of some amazing physician leaders at an organization. And Paul Jachant has helped me, like Lar, all of the Ken, Mohammed, I'm like looking around the room. Everybody's kind of helped me. And I feel like that's really where it is at for us as CEOs and entrepreneurs. The warm intro, there's never been a stronger ability to give somebody right now than the warm intro. So us all kind of helping each other use our networks to get into these hospitals has been probably my third most successful strategy. Whereas before, probably prospecting and cold calling and all of that had a much higher degree of success. It tends to be way lower success today than it was pre-2019.
So, Angela, um, as you're approaching the decision makers in these healthcare organizations, then are you saying that you're getting more leverage from talking about the financial return, the ROI, than on whether you can help them save Jill's life again?
Yeah, it's kind of sad where we are in healthcare. I think we all agree that like we don't love where we are, but we have to recognize where we are nonetheless. So what's going to get the attention for most health systems, I think less than 30% of our healthcare system today is value-based care and like quality of, value-based care where we all wish that medicine would push and go farther. So you still have 70% of the marketplace that's fee for service, and they have to run healthcare as a business. And so getting somebody's attention by saying, hey, not only can this impact patient care in a big way, but you can pay for it and have its own ROI. It is the strategy that gets the most attention.
So how is Inflow doing in the next 10 minutes or so before we open this up to a group discussion? Um, how you doing? What's the next step for you? Because it sounds like you're in a very good place.
Yeah, thank you. 2021 was a build year for us, so we pretty much were focused on building out the product, getting the data that we needed, lighting up our first pilot site. 2022 was really our first primary year focused on bringing in some innovative pilot sites. And then 2023 as well, just a growth strategy. So we have our first 6 contracts that represent about 14 different hospitals and hundreds of clinics, as well as radiology imaging practices. We have 2 of those that represent about 34 different imaging centers. And so we have a pretty large footprint for such a, small, fast-moving startup. Um, I think one advantage that we had was we came later to marketplace than some. There's about 3 other competitors in the space. And we looked at all of the deficits of things that we felt like were their barriers to entry, and we solved for those. So we became very competitive in the marketplace really quickly because we solved around some of the things that we felt like were deficits in other solutions that were out there. But that's primarily where we are. My original founders of Javion, which was the last company that we sold, they ended up starting their own private equity company that focuses on seed round through Series B, which is typically the first 0 to 5-ish years in startup world. And they've been instrumental for me. They seeded this company, so it's nice to have that strong backing and support. And I also have really strong board that multiple of them have owned, operated, and sold AI companies. So we are what's considered pre-Series A round. We'll go to Series A as soon as we hit 1 million in annual recurring revenue, which will be later this summer. So we'll plan to close a Series A round in this year. So that's primarily where we are as a company.
Well, thank you, Angela. And also, before we open this up, could you give us some advice? You know who med releases are pretty well, and you know a lot of the people here in the room. But we just learned how to spell AI, uh, and what should we be doing in our different companies to advance this? This is how you make your living, is by helping healthcare organizations to do that. So, any quick ideas about which we should do after this call?
Yeah, I wrote up I wrote up 5 strategies. I speak on this a lot, and so this is kind of how I organize the problem statement. But for those of you that are on the health system side, and even those of you that are businesses surrounding healthcare, which I think is the majority of the people on the phone, I think we can all use these same strategies to really enter the marketplace. To me, there's 2 things I hear in conversations with especially health system C-suites is we want to and need to, we know and recognize this, um, enter the AI world in a really strategic and thoughtful way. But there is a lot of fear, there's a lot of risk, and there's a lot of like unknowns in AI. And none of that really ties well into a healthcare environment that deals with the health and, and patient safety as our primary goal. And so these strategies are kind of like the ways that I help organizations think through this. But even if you're an entrepreneur, I would think about this in the same way. This first one is going to seem obvious, but I'll tell you why I put it on the list. The first one is start with the problem and then go find the solution. And the reason I say this is because I have so many friends and colleagues come to me from the health system side and they're like, hey, I saw this really super cool tech that's like this AI company. Will you look at it for me and tell me like if you think this is something we should be doing? And they're not really focused on the problem first and sitting down with their team and picking like, hey, what are our top 3 biggest problems to solve in our organization? and then going out and looking for what is the best way to solve this using some of the most innovative things on the market. I even hate using the term AI anymore because I think it elicits a response in people that I don't want. It elicits fear in some people. It elicits an eye roll in some people. It elicits confusion in most people because they're like, what really is AI? Like, how are you defining AI? Like, everybody's using the term. So, who's truly out there doing it? So, like, I don't want to elicit any of those responses. What I try to take them back to is, if I were to ask you if you could like have a magic wand and solve these three things in your health system that you feel like are impacting you the most negatively, what would they be? And let's start there with the problem and then back our way into what is the most innovative solution that we can look at today. That is strategy number one. And a lot of people get that reversed constantly. Um, Strategy number two is just coming up with both a short-term and long-term strategy of how your organization is going to move data in order to be involved in any AI project. You guys know it's going to require a massive data set. And so you guys strategizing, there's companies out there like Rhapsody, AWS, Azure, all of these platforms that help you understand how should I architect all of my data to move it easily and securely and privately from point A to point B. And the end goal, which used to be to just keep everything on premise and lock it up, that's not going to work for the future. If you're truly going to have an AI strategy and you're truly going to be innovating, you're going to have to figure out a way to move your data securely. And right now in health systems, 75 to 80% of them have zero strategy in that alone. But as business owners, this is something easily that you can sit with your team, you can bring in a consultant, and you can figure out how to architect your data to be safe, be transmitted, and to use all of these cloud-based AI technologies. And that's really my number two strategy. Number three, hire outside of healthcare. um,
Mhm.
we are looking at a place in healthcare today in which CIOs of hospitals have been CIOs in health systems for sometimes 30 years. They have had no exposure to how retail has transformed data and used AI to transform data and privacy, how insurance has done it, how finance has done it, and all of these other industries. And by taking somebody from another industry that has already accelerated 10 years into the future past where healthcare is today, man, do you get a different version. We have very much a culture of no right now in the technology departments in health systems, and it is not helping us. It's actually hurting us and costing us money on the daily basis for this culture of no to be able to override all of these innovative projects by just saying, nope, we don't have time, or nope, we can't do that, or nope, that's too risky. But yet, that is the biggest barrier that most health systems face today. So just hiring outside of healthcare, most people that I've seen that are the smart, like innovative institutions, they have new positions that they're adding around AI strategists. And guess what? They're all coming from outside of healthcare. I sat down with MultiCare's leadership, which is a health system out on the West Coast, and they took their new CIO from the Bill Gates organization. And so he's like transforming the way that they view not just technology as a business, but also all of their strategies around using innovation and technology. So number three strategy is looking outside of healthcare for your next hires. Number four, focus on the problems most impacting your staff if you're looking for something that will get you an early win, get you trust with your clinicians, and get their support to try other AI technologies and innovations. And what I mean by that is if you, and probably lots of people on the phone can speak better to this. In fact, I'm looking at three of them. I know you know who you are, but if you're to ask physicians like, why do I hate my job every day right now? It's because of the administrative burdens that we place on them through things like their electronic health record that they spent millions and billions of dollars on. is really kind of their most frustrating part of the day, or the fact that they get 250 different notifications and they feel like they have to spend hours of time not in front of their patients, not bringing joy into their practice, but basically managing insurance and notifications and all of these things that really should never have been part of what we were requiring out of our physicians. And there are so many cool ways to use AI to automate and decrease that administrative burden. And think of like what you're impacting there. Like you're bringing joy back to their practice. You're getting their support. They know that you're listening. So like pick projects in the beginning for these early wins that will impact the joy of your staff more than anything. And you're also, by doing that, you're going to be picking really mature AI methodologies. I wouldn't go necessarily towards the patient safety of, oh, let's predict sepsis and let's, use a patient safety algorithm first. Why don't we fix all of these like burdensome administrative like things that can be easily consolidated and managed by different types of AI methodologies? So that is definitely strategy number 4 is like when you're picking your projects and you're looking at your problem list, make sure that it's something that's impacting one of our biggest concerns today, which is staff turnover, burnout, joy, bringing that back to their practice. And then number 5, like look for easy wins to build trust and support your staff. We were on the phone. I occasionally get to join my own client calls with my team. And I was so glad I joined this one a couple weeks ago. It was with a care navigation team of a large health system that we support. And one of the care navigators just teared up because she said, Angela, what used to take me at least 14 hours a week, Inflow has now turned into a 30-minute task for me. And she was like, I have so much more
Mm,
time. And she was like, last week, I finally got to go to one of my daughter's volleyball games. And it was like, oh, that was like
mm,
a stab in my heart that like she was basically prioritizing all of these manual data entry task that she had to do over going to her daughter's volleyball game. Of course, we're burning our staff out and she was, lacking joy in her day to day. But like that's really what it's all about. So looking for those projects that can have an early win. When I was developing the framework for Inflow Health, in the post-COVID world, I came up with a framework that I very much followed, which is the technology has to solve a major patient safety gap, and use this in as you're looking for different technologies. If they don't meet 5 out of these 7, it's probably not the right choice at this moment. But it has to solve a major patient safety gap. It has to mitigate the health system's liability. It has to drive its own revenue. You have to do it in a minimally invasive technology interoperable way. And you have to develop a workflow that doesn't add any additional load or burden to the staff. So that was the framework that I was like, our product has to do all of these things. When you're picking a technology out there, make sure that you ask all of those questions and that it's meeting every single one of those framework parameters.
Angela, this has been such a nice gift to us about the brain dump from you to us about some of these ideas. How can we return the favor? What do you need? Referrals? We've got your contact information up there. And before I ask everybody to go grab another cup of coffee and sit around and we'll have an open discussion about this, uh, what would you like from us?
Yeah, I mean, a lot of people on this call, thank you so much. You're already giving me so many good warm intros and contacts, and that's really primarily more than anything what I need. So keep that up. For those of you that are on the health system side, let me know if your organization feels like they would like to discover or explore something like this. Absolutely. Um, and then continue to help me iterate and think through like, is there a better way to message? Is there a better way to do these things? I think every one of us that's always what we're looking for is your message constantly has to be changing to meet the demands of where everybody's priorities and where their attention sits. So help me do that. If you ever have any feedback for me, please let me know. That's amazing. And then, of course, looking for the roadmap to the future. Once we solve this for radiology, which we feel like we've done really, really well, we now feel like we can take this same approach into other service lines. So, can we make application to lab now? Can we make application to pathology? Can we make application to other service lines like cardiology, in which they all need this same identification mixed with care orchestration, automation to take better care of the patients in a more preventative way, not at the cost of staff burden. So, if you guys have any ideas on that, I'm always open ears to roadmaps and what the hospital is struggling with most on that side. But thank you for asking that question and for all the intros.